Hello guys, in this video we're going to discuss the last parts of the Chinese medicine theory's characteristics. In our daily practice, sometimes especially for those who are not familiar with the Chinese medicine and acupuncture, sometimes they will be impressed by our treatments. For instance, there's one patient with acute low back pain. So when they move their house, the gentleman tried to move the sofa, but all of a sudden he twists his lower back. He feels very painful at the lower back, and he even could not stand upright. So in this condition, in this case, he went to a Chinese medicine practitioner or went to see an acupuncturist. The practitioner might put the needle on his hand, at the back of both hands, and on each side they put two needles there. And then after a few minutes, the gentleman started to move the lower back, and the pain was eased. And after half an hour, the gentleman may walk freely again. So in this condition, in this case, this is actually a very common case for acute low back pains in our clinic. Sometimes they will be impressed. Why I got a low back pain, and then you put the needles on my hands, and then I can be healed. So these theories behind these symptoms, behind this phenomenon, there's some theories. That's why we can use the points on your hands to treat the low back. It also reflects there are two key characteristics of Chinese medicine and acupuncture in our theoretical systems. One is the concept of holism, and the other one is central differentiation and treatment variation. The concept of holism is one of the key aspects, key characteristics in Chinese medicine. All what we talk about is holism. Holism, it means we see everything as a whole, we see the human body as a whole. That's why in the previous example, we can treat the lower back with the points on the hand. Because as in the holism theories, the lower back and hand, there are some connections in between each other. So that's one of so we're going to discuss what's the content of the holism concept. These are one of the most important concepts, so you have to remember them. Definition: it is a Chinese medicine and acupuncture understandings of integrated of human body and the united of human beings with nature and the social environment. So as you can see from the definition, it includes three aspects: human body, human with nature, and the social environment. So it's the human body itself and the human beings with nature and human beings with the social environment. So what does it mean here? Human body is a whole composed of multiple level structures, which are inseparable in structure, coordinated in function, and affected by each other physiologically and pathologically among various parts of the human body. So you can see from here, it's quite obvious here actually, it's very similar in general medicine or in Western medicine. Different parts of our body, our cells, our tissues, our organs, in structure they can't separate. They need to work together and they function together. For instance, the organs, the 5 organs, you will see when we discuss in details, we focus on the 5 organs. For instance, your heart, your lung, they work together. The lung won't function well without the heart, as they coordinated in function and affected by each other physiologically and pathologically. So in a pathological condition, in a sick condition, they're going to affect each other. For instance, if someone they got the flu and they got a runny nose and then they cough. The coughing might from the lung. In 黄帝内经 also describe that the coughing might from the kidney. That's why in some condition we can treat the kidney. We can use the herbal medicine for the kidney, or we can use acupuncture points to improve the kidney function for coughing. That's because the human body as a whole, they're going to affect each other. In physiological function and pathological function, changes in human body are inevitably affected by nature, environment, and social conditions due to the fact that the human being live in a nature and society. So these are actually focused on human being and the nature and social environment. Nature. The last part, human beings maintain their lives through the process of adapting and transforming the nature and social environments. So these are the contents of the concept of holism. You need to remember these. For instance, if in a test I asked you, could you please describe the content of the content of the concept of holism in acupuncture or in Chinese medicine? You need to write these 4 aspects: the definition, what does the definition means in these 3 aspects. Also, you need to explain with examples to show that you actually understand them. So the first aspect of the holism concept is integrated of human body. Here you can either use integrated or integration. Integrated, the definition of this word is the state of being a whole and not divided. Integration means the act or the process of combining 2 or more things so that they can work together. But actually, when we use the words here, we include both of them. It actually tells us our human body is the state of being whole and not divided. You can't divide our human body into different parts. They won't work in that way. Also, different parts of our human body. For instance, from the table, you can see different systems. The heart system, the liver system, the spleen system. These different systems, they work together. So in this way, it's very close to the definition of integration, the act of or process of combining 2 or more things so that they can work together. So here, although we use integrated, we actually include integration the definition. The first is the physical integration, the holism of 5 Zhang organs. This means that the 5 Zhang organs, if you know when we discuss the Zhang Fu theories, what does Zhang organs mean? So here you don't need to understand why, you don't need to focus on why we call them Zhang organs. As you can see from the table, Zhang organs means the heart, the liver, the spleen, the lung, and kidney. So the holism of the 5 Zhang organs indicates that in physiology, these 5 organs, they work together. They help each other, they also control each other. Here you will see sometimes it might be new to you. As you can see from the table, I write systems. The heart system, the liver system, the spleen system, the lung system, and then the kidney system. Why we write in these systems? It's actually because in Chinese medicine and in acupuncture, when how we really analyze, how we get to know about our human body, we use these systems. So it's very similar when you study your general medicine or when you study your anatomy. You're going to study from different systems. For instance, you're going to study from skeletal systems, vascular systems, muscular systems. So these are the different systems to study our human body. You're going to study the human body from the vessels, from the arteries and vessels. You're going to study the human body from the muscles. Also, you want to study the human body from the nervous system. And then after you study all these systems, you put the systems together, you become a human body. So that's the theories from anatomy. That's how you study. But in Chinese medicine, we use another system. We're going to include different tissues, different organs into different systems. And then we're going to study the relationship among these systems. So for instance, the heart system includes the heart, the small intestine, and then include the vessels, the tongue, and the heart meridian and small intestine meridian. So these we're going to explain more in details in the Zhang Fu theories. Here we just give you an example that the holism of 5 Zhang organs. These 5 organs, these 5 systems, they work together. The integration of these 5 organs represents the integration of human body. Also, the physical integration also include the holism of the body and the spirit. We're going to explain the spirit in the next slides. This is very important here. We don't want to misunderstand what spirit is here. Okay, so we're going to emphasize, we're going to get to know what's the spirit here. Spirit is not spiritual matters, it's not spiritual issues. So we're going to discuss in the next slides. The integrity of human body itself also reflects in the pathologic integrity. So in physical body, different organs, the function of different organs, they work together, they can't separate. When we see one organ, when we see the function of one organ, you also need to see realize that this function includes the other systems. For instance, the heart function includes the lung, spleen. Whenever we talk the heart function, you need to think about that because they can't separate. You can't talk about the heart function by itself. So this is in physical, also in physiology, in our physiological condition. In pathological condition, they work together. Again, if someone got asthma, or very shallow breathing, or very difficult breathing, in this condition, in this sick condition, we have to understand that these symptoms might related to the lung, also it might related to the kidney, because they work together in a physical condition and physiology condition. When in the sick condition, they're also going to affect each other. That's exactly why for asthma, especially for the stable condition, the stable stage, sometimes for prevention, we're going to treat the kidney instead of the lung. We're going to improve the kidney function to prevent the asthma happen again instead of treating the lung. The holistic diagnosis and treatments. This is the example we gave you at the beginning of this video. You can treat the lower back from the hand. You can treat the front shoulder from your leg. You also can find some sensitive spots on your back to indicate condition in the organs, because these are related. The whole body are related. You can find some signs or symptoms from different parts of your body to reflect the other parts of the body, to reflect the problem in the other parts of the body. So here we're going to, these are the symptoms, these are the definition and the content of the holism. Here we need to emphasize again for the spirits. Spirits, here you can see the definition in a broad sense refers to external manifestations of vital and life activities. These include the mind, consciousness, thinking, sight, facial complexions, expressions, body build or body constitute, posture and movement. In a narrow sense, spirit means the heart-mind, mental, conscious, and thinking activities. As you can see from the definition, spirits here it actually means the mind. It refers to the mind, the consciousness, and thinking. It's more related to the thinking and psychological activities. The reason why we use spirits because it's actually because of the translation. It's the direct translation. So in Chinese, in Mandarin, we use the word spirit, but this spirit also not refers to spiritual matters. So for spirits, you will see in the other text, sometimes we use the mind instead of spirit just to, there's no difference between the spirit and mind, just to try to avoid the confusions. Because sometimes if we use spirits, they always think about the spiritual matters, spiritual issues. But here the spirits, we only refers to the mental activities, the consciousness, and thinking activities. So whenever we use spirits in Chinese medicine or in acupuncture, it only refers to the mind, the consciousness. The next is the united of human being and nature. As human being, we live on the planet. We're going to be affected by the nature physiologically and pathologically, no matter in physiology condition or pathology condition. The reason why is because our human body, our emotion, got different response to the nature, to the condition. As you can see from the picture underneath, the first picture is a sunny day, and the second picture, the storm, the thunderstorm. When you see these two pictures, how do you feel? Your emotion, how do you feel? Do you feel more? Do you feel happier when seeing the second picture, or do you feel happier in the first picture? For instance, if just imagine that you were in that condition, you were in the ocean with a small boat with a thunderstorm. You were sitting in a boat, and the other one was sitting on the ground with a sunny day, very peaceful. You feel the same. Your emotion will be the same or not. So obviously from here, our emotion will be affected by the nature. We will be affected by the climate. Also, from the third picture, the movements between the sun, the earth, and the moon. The movement between each other. Sometimes we feel, especially for some more sensitive person, they can feel different, they can have different emotions in different periods of time. For instance, in a full moon or in half moon, they can feel differently in emotion. So these are the situations we're going to be affected by the environment. So when we see a patient, you need to think about the nature, where they come from, how was the weather like, how was the climate and the environment around them. This is going to affect their health as well. So this is the integrated of human being and the nature, and also the nature. Sometimes people live in different areas. They also have different diets. This also due to the nature, the geography difference can affect their different diets. Different diets also will affect different diseases. For instance, someone live closer to the coast, closer to the sea, they have a lot of seafood. Sometimes they eat more salty. More salty foods can cause the blood sepsis. So in those areas, those kinds of environments, those kinds of nature environments, they can have different, they're more likely to have different certain diseases. So this is the human being with the nature. The last part is the integrated of human being with the social environments. The social environments we cannot separate by the social environment because we live in a society. Human beings live in a society. We're going to be affected by the politics, by the economic, by the education, also our age, different gender, different culture, and religions, or marriage status, diet can be affected. We all got different situations of these. This is very similar to the example we gave you in the previous video about the gentleman who want to be an officer and took part in the exam for 20 years, and all of a sudden he passed the exam and he become mad. That's the social environment, the social status change going to affect the emotion, going to affect the emotion, and then going to cause the diseases. Also from the picture at the bottom, on the left side you see the jail. You are a free man and all of a sudden you committed a crime and then you were put in a jail. From a free man to a prisoner, how will these changes going to affect you? So that's from the second picture. A a, a very wealthy person all of a sudden become bankrupt. How do you think about the emotion changes going to affect their health? Sometimes you can see from the TV show or from the movie. In some conditions, they heard that they got bankrupt, and then all of a sudden, the, the person, the boss, got heart attack. That's the social environment changes affect their health. So in this condition, when you see a patient with depression, they come to you, they don't feel happy, they feel depressed, they feel sad all the time. In this condition, we can see it's the liver stagnation. Then we need to figure out what's the root cause. What's the cause behind this situation? What may cause this depression? Because if you don't treat it, if you don't change the root cause, the patient will never be healed. And so these are the contents of the concept of holism. As you can see from here, the concept of holism is something we apply to our daily practice every day, every single day. And actually, it is a very advanced medical models, which include human being, the psychology, and the society. These theories was from 黄帝内经, which we have used for 2,500 years at least. And this is actually the future of the medical. Now the general medicine, they also focus on the emotion, the diseases and the emotion. There's one case I saw in February this year, so about 2 months ago. There's one lady, she came to me for constantly coughing. She said she had been coughing for 8 months, and when she did no runny nose, no symptoms of flu, no symptoms of pneumonia, and she had been to the medical doctor for almost 8 months, and she went through all the tests, all the all the examinations in the hospital, and then everything turned out to be negative. So the doctors told her that the good news is you have nothing wrong with you. But remember, this lady, she had been she had been constantly coughing for 8 months, and then the doctors said that she had nothing wrong. Obviously, that there was something wrong on her, but from the blood test, from the examination, there's nothing wrong with her. So then what's wrong with her? But actually when we see from the prescription she got, firstly she got something for anti-inflammatories, for antibiotics, for, and this doesn't work. This didn't work, and then the doctor gave her antidepressant. You see, from these tablets, the difference between there is from the physical diseases, coughing, they find something, there's nothing wrong with the coughing, although they use some medicine and the medicine didn't work. Next, they give you antidepressant because they thought that this coughing, if there's no physical damage, physical signs of damage in the body, it must be psychology. So they gave you antidepressant. Although it still didn't work, that's why the lady came to me for Chinese medicine. So, but from this phenomenon, you will see the Western medicine. The Western medicine they developed until now gradually. They also omit the medical models of physical body, of human being, and psychology and society. They actually changing gradually to this model. They don't only focus on the physical body only. So this is might be the future of advanced medical models, how we treat the patient. Next, we're going to discuss the syndrome differentiation and treatment variation. So syndrome differentiation, this is from, you still remember where does it come from? From the last four classic, 伤寒杂病论. So in 伤寒杂病论, the author, Zhang Zongjing, gave us examples of how to apply the theories into clinical practice, use the syndrome differentiation and treatment variation. What does it mean here? Syndrome differentiation and treatment variation is the thinking and practical process of applying the theories to analyze the relevant symptoms of diseases, demonstrates its therapeutics principles, methods, principles, materials, medical, and applying into practice. So from the definition, you can see what we analyze is the symptom, the relevant symptom, and then we demonstrate the principles, methods, prescriptions, and apply into practice. So syndrome differentiation and treatment variation actually includes two aspects. The first is analyze the symptoms. The second is apply into practice. So there's two actions here. First, analyze the symptoms. The second is apply into practice. So when you see from the picture on the right side, these two tongues on top, this one, there are two tongues. The one here, the other one here. When you see these two tongues, why they got different colors? This one's pale or light red. This one's red. Why they got different colors? Also from this tongue, you can see there's something here on the side. When we study the diagnostics, you will know this we call the teeth mark. Is the teeth mark stay on the tongue? What does this means to us? Or when you see a Chinese medicine practitioner, very typically you're going to be impressed by the diagnostic methods. The doctor will ask you to put your hands on the cushion, and then the doctor is going to feel from your pulse. What do they feel in this process? How can we see? How can we diagnose from these different signs? So before we're going to discuss in details, we're going to distinguish the different definition of these three terms: diseases, symptoms and signs, and syndromes. So diseases means the full development of one disease, such as hypertension is a disease, diabetes, or asthma. These are diseases. Diseases means kinds of disease. Symptoms and signs. Symptoms and signs. Symptoms is something that the patient can feel. The symptoms and signs is sometimes quite tricky. Signs is something the doctor, the practitioner finds. Symptoms is the discomfort the patient tell you. Symptom is a group of symptoms and signs. So when we say syndrome differentiation, we actually talk about a group of symptoms and signs. Also, sometimes we use patterns. That's why patterns means a group of symptoms and signs. So if you knew the definition of these three, you will know from the right side, hypertension. Hypertension is a disease. Headache. Headache refers to symptoms because headache is not something the doctor can see. A practitioner, as a practitioner, we can't see the patient got headache, or we can't see how bad the headache was. That's something the patient will tell you. That's the symptoms. And then the tongue, the red tongue, or the teeth mark around the tongue, that's the signs. These are the signs that we can see, or some abnormal condition from the physical examination. Then we call them signs. So firstly, we're going to talk about the syndrome differentiation. It's the thinking that the practice involves in order to establish syndromes which aids to the process of understanding diseases. So we When we see a patient, when we try to analyze the diseases, we always find the patterns, the symptoms, how to find the symptoms, how to understand the symptoms. We're going to use the diagnostic method, include the signs and symptoms, and use the theories to identify the cause, the nature, the location, and development trend of diseases, and then summarize and conclude the specific nature of symptoms. So these are the symptom differentiation. What we want to do is to understand the diseases. We want to understand what's wrong with the patient and how we use the four diagnostic method to find the signs and symptoms. So the third is the purpose is to understand the diseases. How to do so is to use the four diagnostic methods to find the signs and symptoms. And then once you find the signs and symptoms, you're going to use the theories we discussed here to identify the causes, the nature, the location, the development of trend of the diseases, and then conclude to a specific nature of symptoms. So that's the symptom differentiation. The purpose is to understand the diseases. You want to understand what happened to the patient. How to do so is to use the four diagnostic methods to find the signs and symptoms. So for the four diagnostic methods we're going to discuss in future in our diagnostics, you're going to learn all of them. And after you find the signs and symptoms, you're going to use the theories we have learned to analyze these symptoms and signs and then conclude to a symptom. So that's the symptom differentiation. From the definition, you need to understand what's the purpose, how to do so, causes of diseases, the location of diseases, the nature of diseases, development trend of diseases. When we discuss the differentiation, we're going to discuss more in details. We just have a general idea that, as you can see from here, the different tones on the right side, the different color of the tones indicates different body condition, or different coating of the tongue also indicate different body condition. Why this tongue was red, there's thick coating on this tongue and white coating. Why this chew, why is the coating was white and this coating was slightly yellow? What can indicate at the back of these signs? It's from symptom differentiation. So after you study the symptom differentiation, you will understand what happened to here and how to treat this. So the next one is the treatment variation. Treatment variation is a thinking and practical process of establishing treatment principles and methods, and that's appropriate treatment methods to treat diseases on the basis of syndrome diagnosis derived from syndrome differentiation. So from the definition, you will see the treatment variation means we're going to establishing the principles how to treat and see that's appropriate treatment method how to select is according to the syndrome differentiation. So you see these two, why we put together syndrome differentiation and treatment variation. Why we put together, actually you can see from definition, it's actually the process before and after. The first step, when a patient comes to us, we need to find the symptoms and signs for diagnostic methods and conclude to a surgeon, and then for the treatment. We need to establish the treatment principle from the surgeon and select the proper treatment method according to the surgeon. The treatment principles are concluded from surgeons. A formula is selected according to treatment principles. Treatment based on family. So symptoms and signs from the patient when patient comes to us, we can conclude to a surgeon. From the surgeon, we can have the treatment principles, and then we can choose the formula and apply into practice. So these are the full process of syndrome differentiation and treatment variation. From here to here, to find the symptoms and signs to conclude the syndrome is called syndrome differentiation. And then from the syndrome differentiation, we're going to determine the treatment principles and choose the formula. Choose different formulas. These are treatment variation. As you can see here, it's quite theoretic. Sometimes it's a bit complicated. So we're going to give you some examples. What does it mean by syndrome differentiation? What's the difference between treating the disease and treating the symptoms? Treating the disease or treating the symptoms. So the first one is treating the same diseases with different formulae. So there was a lady, a runny nose, sneezing for 2 days. She got sore throat and a red tongue with thick yellow coating, a thin yellow coating, floating pulse. So the patient got runny nose, sneezing for 2 days. And the signs we can see was the red tongue, yellow coating, floating pulse. So from here, we're going to diagnose this patient got flu, or the symptom, the flu due to wind heat. We're going to, after we study the theories in future, you will know why it's wind heat, because the floating pulse and also because of the yellow color, red tongue indicate a heat condition. So this flu was due to wind heat. That's the syndrome. The treatment principles dispel wind heat. So the treatment principle is based on the syndrome. It was a flu patient. The syndrome is due to wind heat. So the principle is just to dispel the wind heat. We choose one formula called Inchao-san, and then we apply into practice. And eventually, this patient can recover from the flu. Okay. Then there's another gentleman. He got runny nose and sneezing for 2 days. He feels fatigue, coughing, pale tongue with thin white coating. Also got floating pulse and tense pulse. The diagnosis was still the same. Also, this patient was also a flu patient, but the syndrome was due to wind cold. The treatment principle dispel wind cold, and then we choose another formula, Ma Huang Tang. We apply into practice. This patient also recovered. But here, these two patients, when we put these two cases together for diagnosis, She was a flu patient. He also got flu. When heat, when cold, there's different symptoms. The reason why they got different symptoms is because the red tongue, the color of the tongue, and the color of the coating, and also the pulse. The lady got the red tongue, yellow coating. This gentleman got a pale tongue and white coating. Also, this gentleman got fatigue. So in this condition, we diagnose as wind cold. Because of different symptoms, we use different treatment principles. For the lady, we use the principle to dispel the wind heat. For the gentleman, we use the treatment principle to dispel wind cold. So according to the principles, we choose different formula. The lady we choose Yin Chao San. The gentleman we choose Ma Wang Tang. That's because of according to the treatment principles, and then both of them can recover. But when you look back to this case, both of them, they got the same disease. They got flu, but we use different formula, and then they can recover. That's treating the different diseases with treat the same diseases with different formulae. The next one we're going to show you as an example is treating the different diseases with the same formula. There was a patient with stomach ache, poor appetite, diarrhea for a few days, and pale tongue with a thin white coating. So the diagnosis for this patient, he got diarrhea, and the symptoms was due to spleen deficiency. So for here, you don't need to focus on why these symptoms cause spleen deficiency, because these are from the symptom differentiation. When we study more theories, we will understand why. For appetite, all indicates the spleen deficiency. From the spleen deficiency, the treatment principle was to tonify the spleen. Treatment principle, and we choose the formula 补中益气汤 to apply into practice. There's another lady, female, she got menstruation bleeding for 3 weeks. So that's irregular menstruation. She got fatigue, low abdominal pain, pale tongue with thin white coating. So the diagnosis, irregular menstruation. The symptom was due to spleen deficiency as well, because the patient got fatigue, got a pale tongue with thin white coating, and bleeding. So we diagnosed as spleen deficiency. The treatment principle was to tonify the spleen. We choose 补充益气汤, and the patient recovered. And then from these two cases, when we compare, the first case was a diarrhea patient. The second was irregular menstruation. But you see the symptom, because spleen deficiency. The patient, the diarrhea was due to spleen deficiency. The irregular menstruation we also diagnose as spleen deficiency. The treatment principle is the same, to tonify the spleen. So we use 补中益气汤. But when you look back to the diseases, one is diarrhea, one is irregular menstruation. Then you can use the same formula, and the patient can be recovered from there. So these are something very special in Chinese medicine. We might treat the same disease with different formulae, or we treat the different diseases with the same formula according to the symptoms. Okay, so here we give you the example from the herbal medicine, the 补中益气汤 or in Chao Zai Ma Huang Tang we mentioned here is the prescription, the herbal medicine prescription. Here you also can use acupuncture points. So you also might use the same acupuncture points for different diseases, or use different acupuncture points for the same diseases. Because no matter the herbal medicine or acupuncture, what we mostly treat is from treatment principles. If they share the same symptom, the treatment principle will be the same, and then the treatment methods, we also can use the same method. So that's the symptom differentiation and treatment variation. So the treatment varies according to the symptoms. Apart from the symptom differentiation and treatment variation, sometimes we also treat based on the diseases. Although we don't use this often, but it's true that we also use, for instance, the sweet wormwood or qinghao we use for malaria treatment, or daihuang mudan tang is one of the formula, the herbal medicine formula we use for ulcerative colitis, the inflammation in the colon. Or the furrow shoulder, we use acupuncture point with stomach 38. We don't care what kind of symptoms. We don't care what kind of symptom. We don't care what's the tongue color, what's the tongue coating. We use stomach 38 for furrow shoulder. The treatments according to the diseases. So although we in Chinese medicine and in acupuncture, we more focus on the symptom differentiation. The treatments we more based on the symptoms. So don't laugh at the Western medicine. You see, sometimes they say that for the Western medicine, someone got headache, they treat the headache. Someone got the pain in the feet, they treat the feet. Someone got the pain in the stomach, they treat the stomach only. Don't always laugh at them, because sometimes we also do so, because these will depend on the condition, when to treat the manifestations or when to treat the root cause. We need to decide. So sometimes we also treat the diseases, we treat the symptoms. So when in our treatments, it's actually the combination of symptoms and diseases. So in these few videos, we have discussed the general introduction of the basic theories of Chinese medicine, and then the main content of the basic theories we're going to study here in this discipline is to understand the philosophies we use in Chinese medicine. What's yin and yang theories? What's the 5-element theories? Where they come from and how to apply these theories in our practice. We also need to understand the physiological condition of our human body, because you need to understand what's the normal condition. Only if you know the normal condition, you will know the pathological condition. You need to study from a standard model. You need to know what's normal before you can figure out what's abnormal. So that's the content of Chinese medicine theories. Also, to understand the diseases, prevention, and treatments in Chinese medicine and acupuncture. So you need to understand what's the cause of the disease, how to prevent the diseases, how to prevent being sick, and how to treat the diseases. So that's the main contents we're going to study in the basic theories.